In this video, I'm going to help you find out what stage of stroke recovery you're in. That way you can find the right exercises and help you continue your progress at home. Welcome to Indie Stroke Rehab. My name is Evan. I'm an occupational therapist and I help stroke survivors continue their recovery at home. Knowing what stage of stroke recovery you're in is something every stroke survivor should know. It's like having a roadmap laid out in front of you of your recovery ahead. As you push through each stage of stroke recovery, it's like unfolding a new section of the map, revealing what to do next. Having this map of the stroke recovery stages will help you in a few ways. And the most important way is it's going to help you find the just right challenge, exercises, or evidence-based interventions to help you progress from your current stage to the next stage. This map will also help you set realistic expectations on your recovery timeline, and it'll help you measure your progress over time. Before we jump into the self-assessment part of the video, I want to make a quick disclaimer in that these 6 stages of stroke recovery are just typical stages of stroke recovery. Not every single stroke survivor is going to go through these 6 stages exactly as they are, but for the vast majority of stroke survivors out there, they can expect to be in one of these stages at some point in their recovery. Also, it's very common to have different stages for your arm and your leg. So don't be surprised if your arm is a little bit lower than your leg or vice versa. This is pretty normal and common for most people, for most stroke survivors. So just keep that in mind as we go through these stages. The first stage of stroke recovery is called flaccidity. Flaccidity is when there is no movement or tone in the muscle and your limb is going to be completely limp and show no signs of movement. Stage 2 is beginning of spasticity. Similar to stage 1, your arm is going to be very limp and it's not going to have any kind of movement. However, you're going to now start showing signs of spasticity. Spasticity is an increase in tone, a resting contracture of the muscle, and you will start to have some kind of catch whenever you're performing passive range of motion on your affected extremities. In stage 2, you're going to also notice other signs of life. Things like muscle twitching and associative reflexes, which are when your arm may come up into a flexion motion whenever you're coughing, sneezing, or yawning. And towards the end of stage 2, some individuals will even be able to initiate some slight movements, but that'll be irregular. Stage 3 is called peak spasticity. This is when your affected arm or leg is going to be the most stiff and the most resistive to active and passive movements. Stage 3 is also when synergy patterns emerge. Synergy patterns are patterns of movement that cause multiple muscles and joints to move together instead of separately. One example of a flexor pattern for stage 3 would be trying to perform a simple one joint movement such as elbow flexion, but instead having your arm look more like this, where it goes into scapular retraction and elevation, external rotation and shoulder abduction, bicep flexion and supination, and wrist and finger flexion. Here is an example of a leg synergy in stage 3 of stroke recovery, starting in a seated position going to a standing position. Your leg will go into hip extension, adduction and internal rotation, knee extension, ankle plantar flexion, inversion, and toe flexion. It's important to note that during stage 3, you will not be able to perform any movement outside of these basic synergies. Stage 4 of stroke recovery is decreased spasticity. In stage 4, your spasticity will start to decrease, allowing for more movements with your extremities. Some new movements out of these synergy patterns will start to emerge. For example, if you had a strong flexor synergy of your arm in stage 3, you may now be able to start performing some elbow extension in stage 4. To be in stage 4 stroke recovery, you will need to be able to do one of the following movements with your upper extremity. The first movement would be to be able to get your affected hand behind your back. This is a disassociation of your pectoralis major, your chest muscle, from your tricep muscle. Or you should be able to complete a pronation supination, so palm up, palm down movement, while your elbow is at a 90-degree angle and stuck at your side in a adducted position. And this would be a dissociation of your supinator muscle from the bicep muscle. And the last movement you should be able to do would be shoulder flexion, which is raising your arm while keeping your elbow extended. And this would be a disassociation of your pectoralis major or your chest muscle from your tricep. So you don't need to be able to do all 3 of these movements, just one of these movements to classify your upper extremity as stage 4 in the stroke recovery process. To be classified as stage 4 for your leg, you only need to be able to do one of the following movements. You should be able to perform knee flexion beyond 90 degrees by sliding your foot on the floor, or perform ankle dorsiflexion without lifting your foot off the ground. Stage 5 of stroke recovery is complex movement patterns. And as the name suggests, you should start to be able to perform complex movement patterns. During stage 5, your spasticity will continue to disappear and your synergies will start to fade. You will start performing more complex movements, and to be classified in stage 5 of stroke recovery, you should be able to do at least one of the following movements with your affected extremity. Shoulder elevation beyond 90 degrees and up to 180 degrees. The second movement would be to perform shoulder abduction to 90 degrees with your elbow in extension and be able to pronate and supinate, which is move your palm up and down and maintain that abduction of 90 degrees. And for the leg, you should be able to do at least one of these following movements to be classified as stage 5. Knee flexion while standing, or ankle dorsiflexion in step standing. Stage 6 of stroke recovery is spasticity disappears. And in this stage, all of your joints should be able to be moved independently. In this stage, you still may have difficulty with complex tasks or skills like writing, typing, or performing skill-based movements like shooting a basketball or swinging a golf club. Stage 6 is really about remastering all of your lost skills and abilities. And that's it for the self-assessment video. If you found this video helpful, the best free thing you can do is give me a like and a comment down below about what stage of stroke recovery you're in. This will help me identify what stage most of my viewers are in and can help me prioritize what videos I should make. And now that you know what stage of recovery you're in, be sure to check out our playlist over here. These videos in this playlist go through an overview of your current stage, help you identify what the goals are and what the evidence-based practice is to help you progress from that stage to the next stage in your recovery. Thank you guys so much for watching and have a wonderful day.